No one expects a diagnosis of cancer to pop up in their lives, but when it happens in your child, it can be absolutely shocking. Today's guest is Jennifer James, who's going to share her story of having her 5-year-old daughter diagnosed with childhood cancer. Thank you for joining us for this episode of Talking Health in the 406, where we're one community under the big sky. I'm your host, Jennifer Vansickle, longtime healthcare worker turned health educator. Can you take us back? So how old is your daughter now?
She just turned 15, so it's
15.
been 10 years.
So tell us about 10 years ago. Was she a great, healthy, young 5-year-old girl?
Yep, she had just turned 5. We'd had a really fun birthday for her, and she and her brother were out front. I was with them. They were all bundled up in their snow gear, and we have a little hill in the front yard, and she dove on the sled and hurt herself and needed to lay flat on her back. And I, at the point, small children, a 3-year-old and almost 3, he wasn't quite 3. I was just frustrated. I was like, okay, we'll just go lay inside, right? I'll come check on you in a minute. And so she came inside, and then for 2 days, she just wanted to be flat on her back. And so we took her in thinking, what in the world? Not a big hill in our front yard.
So was it her back was hurting, or was her tummy?
It was her side, but she wanted, for whatever reason, she wanted to be flat on her back. And so we took her into the emergency room after, looking back now, probably shouldn't have waited 2 days, but it just didn't seem to be a type of accident that would have created any sort of major injury. And she was diagnosed with a lacerated kidney. Wow. So we went then for another close to 2 months, 6 weeks to 2 months, kind of monitoring, and it didn't heal. And at that point, her pediatrician, who we love and adore, sent the scans over to a doctor in Spokane. And that was the first time we'd heard Wilms tumor.
Okay. So just to pause you with the lacerated kidney. So basically a laceration is like a cut. And so they did a CAT scan or some sort of imaging, I'm guessing.
Mm-hmm. Yeah.
And did it have a bulge? And they thought, oh, it must be bleeding into like the capsule around the kidney. Or to me, I worry with like a cut kidney. Oh my gosh, we're bleeding internally. We need to go to emergency surgery. But
yeah, they monitored, I don't know what levels they were looking at. And initially they had used an ultrasound, and I think they saw a mass. And then I think they just thought it would heal, that if she took it easy, which she did, and just rested and, didn't do any major physical activity, that it would heal on its own. And then when the imaging came back again, that, there still was this mass, is I think what it was being, what it looked like to them, that's when we first heard the term Wilms tumor. So.
Wow. And they knew locally at the Helena Hospital, okay, we need to send you elsewhere for this, or was it up to you guys to go elsewhere and get a second opinion?
It was our pediatrician who initially found that out. She sent the picture to someone in Spokane, to a hospital, I think it was a urologist, a pediatric urologist, who she sent the scan to. And that was the first time, the first person who had actually said that. It wasn't actually diagnosed here in Helena. But then, and so we were planning kind of to go just to Spokane, just to see that doctor. And then, we talked to enough friends who were in the medical community, and it just seemed like it was probably worth it to keep driving and get to Seattle Children's. So the next morning, we heard about it in the afternoon on a Monday. And of course, everyone's heard these stories. The next Monday, I hopped in the car with her, and my mom decided to ride along, and we drove to Seattle. And my husband stayed here with our little guy.
And were you able to get an appointment out in Seattle that fast, or did you guys?
Nope. Our pediatrician, she's amazing. She called, and she even switched it from Spokane to Seattle within a matter of hours, once I kind of had made my mind up that we were going to keep driving to Seattle. She was able to get us in, and I can remember, clear as day, just the riding from the little hotel we've always stayed in now. It was the first time we'd ever stayed there, riding the hotel shuttle up to Seattle Children's and going in and having this itty bitty little girl. And, it was all so foreign. Like, I don't have a background. We'd never had anyone in our family with cancer. I don't have a background in medicine. So it was a whole new ball game for us.
And so you saw the word Wilms tumor come at you the first time you heard it. Had you ever heard that term before?
Oh, no.
So did you hit Google, or did your pediatrician or somebody say, this is a type of cancer, here's what we're going to do? Or was it?
Well, she said over the phone, that the term Wilms tumor. And so of course I Googled, and it's 95% curable. And I think our pediatrician maybe had told me that on the phone, but still you don't know. And of course, there's been so many twists and turns even since that diagnosis. So Yeah, it was definitely, I don't know, maybe a blessing in disguise to have been so naive. I'm not sure. Like, I'm not, looking back
Mhm.
on it, had I known, it probably would have been harder had I known
Yeah.
what we were walking into.
Wow. And so when you
Yeah.
got out to Seattle Children's, did they admit her and take her and redo all the scans and all the tests, and everything? Or when you got out there, was it just a meeting in a doctor's office with one of their providers? What did it look like
They
when you first got there?
did scans and blood work. They had to, because she was so little, I believe they had to, yeah, I think they put her to sleep so that they could get her to lay real still, and did the CT and got the imaging, and then the blood work. And I can remember the three of us sitting then in with one of the providers, and them automatically going in to start analyzing all the blood work, like showing me her white blood cells, like looking at all of the numbers. And it didn't even occur to me, like, and maybe it had come out of the doctor's mouth that she had cancer and I didn't hear it, or maybe the doctor just went into like her normal sort of, because once we got into the routine, that's what you would do. You sit down, you go through the blood work, you look to see, okay, where are we at? Where are her platelets? So it kind of started out that way. And I had to be like, hold on a minute, like, what are we doing? Like, what is like happening here? So whether it was me not hearing it, or I don't know. It's very surreal to think back on it,
Almost
because I had to really ask and say, whoa. So,
the inertia that, I mean, you see it a lot in the medical field, the inertia of thinking patients and people know more than they do. Here we're
yeah.
on this freight train and now we're moving forward and everybody's saying, what do you mean?
Yeah. Well, and she
Interesting.
probably, to her defense, the oncologist, it's probably what she does in every appointment, right? But I needed that conversation of, okay, Vivian has cancer, I needed it to be that blunt. So, and to have a minute for it to sink in. So, yeah, I think it took a while for all of us for it to sink in, but she then, trying to think how many days, I think that happened. And then maybe just a couple of days later, she went straight into surgery.
Wow.
So they didn't admit her right away. We went back to the hotel, and it may have even been the next day, but surgery happened pretty quickly.
Wow. And so what did that surgery look like? Did they take out her whole entire kidney, or was it just that tumor, just that mass
Well,
itself?
this is where, the twists and turns start.
Oh, okay.
Anyone who's been through cancer treatment, it just never goes the way, and in my brain too, I like to run scenarios. So I would run all the different scenarios, and then inevitably it would always be different than whatever scenarios I had run. But so they started the surgery, and her surgeon, who was the head of surgery at Seattle Children's, got in, and they did a biopsy. And the plan was actually to pull the entire tumor, and the kidney. But they thought they saw a spot on her other kidney, which then puts you in the bilateral category. It puts you in a whole different treatment plan, because they want to preserve as much kidney function as possible. So they essentially put her port in and then sewed her back up.
And so what is a port? What is that?
Oh, so a port. Yeah, I wouldn't have known that either prior to all of this. It's a line that they give you that goes directly to your heart. And then it makes it much easier to administer chemo, or anytime you need an IV, they just access your port then. And so then you don't have to, which was just a blessing, lifesaver for us, because she was so little and her veins were so little. Anytime they went to give her an IV, it just was not fun for anybody involved. And then before any procedure, they ask you not to drink any water or eat any food. So then, she'd be dehydrated on top of being so little. So the port then just allows them access to her. It's a direct line to your heart, but it gets you into the bloodstream. So it's how they would then draw her blood to do tests or administer chemo, or, whatever they needed to do. So they put the port in so that she would be ready for everything, and then sewed her back up and gave us the news that she had fallen into this bilateral category, and that they wanted to do chemo first to shrink the tumor, and then save as much of both kidneys as they could, in case she were to relapse down the road. Because, you don't want to, with children this small, if you cure the cancer and then you automatically put them into a high-risk kidney situation where you're then on dialysis and needing a transplant, that's not good either. So they're trying to be conservative and balance all the different issues. So,
had you even considered the bilateral category when you were going through the different scenarios? No,
I didn't even know that existed. Yeah. And then when the pathology came back, so then the spot on her other kidney wasn't even large enough to biopsy. So, whether or not that's still, looking back on it, hard to say, but, you have to appreciate, you can't question looking back. And, But she also was then determined blastemal, which is like this weird, so I think the other term is anaplastic, but it's like not just your plain old Wilms. It's like another variation then of Wilms. And I think probably all cancers have that, where there's like these weird mutations. And so all of a sudden we've now found ourselves not in the 95% curable category because it's become more complicated.
Wow.
So.
Did they give you a percent at that time, or any numbers?
Probably. I don't remember. And I think, long ago I stopped even listening to the numbers because just knowing my brain, it wasn't really helpful to spend much time on those numbers.
That makes sense. So she started chemo, I take it then. And
the
how
next Friday, it's crazy how fast.
A pill or liquid that they put through the port? What did the chemo look like and how did she react to it? How was
It's an infusion through the port. Yeah. And it was the first bit we did, it was all outpatient. I'm trying to remember. Yeah, I think it was all outpatient. The tricky part though for us was, so after they hand you this big paper bag full of medication to help manage the pain and the nausea. And, it's Zofran, and then there's like this Benadryl Reglan mix you can use, and then there's Ativan. And so then they explain to you like how you can use all of these different and how you like stagger them and when you use what, and you're already kind of like in shock over the whole situation, and then you're handed this big bag. And it took us a few, I would say, months, unfortunately, to kind of figure out what worked for her body and how to really manage the side effects, because that was pretty brutal. And so I'm trying to think too, they did the chemo and she responded well to the chemo, and we did, I think, like 3 months of that, and then radiation as well. And that was rough because they started the radiation right on. So already, you've had a surgery, you've had all this chemo, and then went into radiation. And what they can do to a child's body is different than what they can do to an adult body. Because if they had done that to us, our bodies don't recover as adults as quickly. Whereas that you can hit a child's body pretty hard with cancer treatment just because of how quickly and I don't even like to use the word resilient because I think I don't know. It's just that their bodies are different. So did the radiation, which was really rough, and then a surgery.
Why was the radiation rough? Did it burn her skin, or did it make her sick as well? What did that look like? For like I guess the radiation, and then
it made her really sick.
Interesting.
And
okay.
I think she was already really worn down from all the chemo. Mm-hmm. And then you do radiation. I think she did it every day for 2 weeks. And, the part for me too, is that it was really unpredictable. Whereas with the chemo, we had kind of figured out that like on day 7, if we gave her this medicine, this would help. And then by day 10, we could do this. And then by day 12, she'd feel better. Like we had figured that out. And then the radiation just was really like, she'd have the whole, and then go like 4 days and then get sick. Like for me, I couldn't predict when she was going to feel miserable. And so then it was hard because we couldn't help her because I couldn't like get ahead of it. And I think for me as the mama, that was a really hard part of it because you wanted to be able to make it better. And I just couldn't. The radiation was just so unpredictable compared to the chemo. And at least for us. I don't know if that's true for everyone, but
this whole time you guys went out there, you're staying at the same little hotel. You hadn't been home yet. Did you come home at all during all this, or is this all in one?
She and I had not been home, but we had friends who let us borrow, first of all, their home in Snoqualmie, which was a huge gift. They had one that was kind of in between renters or something. And so, but that's a little ways outside. We were there for probably 6 weeks, maybe 2 months, April. Yeah, something like that. And, but then when we got to this point where she needed to be closer to the hospital, they ask because of the ICU, they want you within a certain distance of a pediatric ICU when your child's going through treatment in case they were to crash. And so we were like really right on the edge, but it was great for the first few weeks just because it was kind of a home and more of a residential setting. But then we had some friends who had a condo really close to the hospital and they let us borrow that condo. And we moved there for the duration then when she was going through radiation, and things were really rough because then we were closer, because anytime they run a fever, you have to go to the emergency room because they want to monitor them really closely just because their immune systems are so fragile during treatment. So
wow. And so you'd been doing chemo and then radiation for weeks. Did they rescan at that point in time? And were you able to tell what's going on?
Every once in a while they would. And, I might have gotten trying to remember where the surgery fell with the radiation. I think she did surgery and then went into radiation, and they used the radiation to kind of mop up anything else that was there. So they had the tumor removed and then did the radiation. And the surgery was rough just because it's such a big surgery. Cutting just through all the muscle, the entire abdomen. We joke now, because it's easy to joke now this far out, but that she should have just had a zipper put in because of all the different, times they've gone in and out to work on her kidneys. But, and so at that point they removed, I don't even think it was a quarter of her kidney and the entire tumor. So, and then the radiation, and then we got to go home. And I think she and I were there for 8 months after that stint.
Wow.
Yeah.
Oh my goodness. And if I can ask, did she have kind of what, maybe the rest of the world, the laymen think of with the chemo, like loss of hair?
Oh yeah.
A complete loss of appetite. And how was she handling this as a 5-year-old? Was she, like you say, kids they are resilient, but I mean, I can imagine what an adult would be feeling like. What was her emotions, and how was she doing with all of this?
She was amazing. And she did lose her hair. She had to be on a feeding tube. And of course, in my head, I think it was my coping mechanism, thought, well, she won't lose her hair. Like, the chemo won't be that strong. Because with the typical Wilms tumor, there are cases where you can go on like a real light dose of chemo and it's enough. But that wasn't what she was on. So she lost her hair. And then she wasn't, I wouldn't say, a great eater to begin with anyway. And then she just felt crummy the whole time. And I would try so hard to make her eat. And so the feeding tube was actually, as much as I dreaded it, it was actually really helpful, because then we didn't have to fight that battle. It just kept her tummy full. And so that got her through. And then taking her to school this morning, I asked her what she wanted me to convey and like what she thought was important. And so we kind of talked through it a little bit. And we talked about this decision to go to Seattle. And I think one of the biggest things that was so helpful to her was they had a school. So she actually got to start kindergarten at the school at Seattle Children's. And they have music therapists and art therapists, and they have an entire department of the hospital called Child Life, which is people who are trained to talk to the kids about their diagnosis and also about the procedures. And Miss Alicia was the name of the woman who was Child Life for Oncology, and she was fabulous. Like, she'd bring a stuffed animal. It was an octopus that showed like how all the different lines were going to work for Viv, like her port. And so they had tools like that they would help the kids understand. And she still loves going back. Like, I think they have said that some kids, get to the front door of the hospital and throw up immediately because they're so traumatized. And that was not the experience that Vivian had. She just is very fond she loves being there, and she loves all the people there. And so if for no other reason, being in a pediatric facility like that was worth it to us, just because of how well how she grew both physically and mentally. Because that's the other thing with the feeding tube and the not eating, their little bodies are still developing, and they have to still grow even though they're in treatment, which is, again, super tricky.
Did she grow? I mean, do you see the repercussions of that now? I mean, is she shorter in stature or anything like that?
Petite. They radiate your entire abdomen because they don't want your spine to get curved, because if they were to just radiate one, even though her cancer was only on one side, they didn't want her spine to grow wonky. So then you don't grow in that section of your spine where you've been radiated. So she's probably, I don't know, a little more petite than she would have been, but I don't think significantly. And she grew through treatment. The other thing that's really fascinating too is she has an endocrinologist, and they x-ray her hand. She probably has another year. She's growing a little later than other girls her age, just because it kind of just delayed development those years she was in treatment.
Okay.
Yeah, it's fascinating.
Mm-hmm. Yeah. And when you stop and think about how different we all are with growth anyway, how you have the kiddos in high school that don't shoot up till they're 17, and others are fully grown by the time they're 13. And
hard to know.
Yeah, definitely. Oh, wow. So when you finally left Seattle and came back home to Montana, was she given the cancer-free diagnosis, or did you know you were just going home for a couple of weeks and coming right back and continuing the battle? Or where were you at that stage after she'd been having chemo and radiation for that long and had the surgery?
Came home with the hope that she was good, and went for her checkups every 3 months, where they would do an ultrasound and a chest x-ray, because If Wilms is going to migrate, there's a better word for that, but I'm not going to come up with it. It would go to your lungs.
Metastasize. Yep. Okay.
Metastasize, yes. The lungs is that's where it likes to go. So for 2 years, we were actually, so they have you do that every 3 months for 2 years. And we were to her appointment where we would have been able to go to 6 months when we found out that she had relapsed, that the cancer had come back.
And was it in the same kidney, or tell us about that?
Exact same location. So we went into a bunch of conversations around what next, and we decided to go the route of a stem cell transplant. So she and I moved back to Seattle and then rented an apartment very close to the hospital because we knew that this treatment was going to be a lot of inpatient. The stem cell transplant, you end up, it's not as long as a bone marrow transplant, but because they use your own stem cells and they give them back to you. It's kind of a recovery method with a solid tumor versus if you've got leukemia, which is a blood tumor, and then you get a donation from someone else, and that's a bone marrow transplant. So it's a kind of a variation on that.
Can you tell us more about that stem cell since transplant? So where did they get it from Vivian? Was it just blood or was it bone marrow, or tell us about that?
They use my husband was there for the procedure, but they use the artery in your leg. And so they give you a line, and that's how and then they have this machine that spins, I guess, really fast, according the way they described it to me. And it pulls the stem cells out of your blood somehow. And so then they freeze those and save them. And then they put you through this really extensive chemo where they give you like the strongest amount of chemo your body can handle to kill all your, any fast growing cell. So it can cause hearing loss because you have hair, right, in your eardrums, and you lose all this hair. It's really hard on your mouth because you have a lot of fast growing cells in your mouth. So like mouth sores, it's pretty brutal. And so if that's the same as what they do for a bone marrow transplant as well. So they give you and then they essentially rescue you is how they put it. They give you back, in Vivian's case, gave her back her own stem cells to rescue her body. And then you wait for, that to kick in and to bring her body back. And my husband we kind of had this deal where he would do the inpatient and I would always do all the outpatient stuff. So he and Vivian set up camp, and I think they were there for 37 days on the oncology floor for the whole process.
Wow. Did he stay in the room with her, or did he get his own hotel and go get a break?
No, he stayed with her the whole time.
He did. Okay. Wow.
Yeah. Well, they have the room set up there for there's a bed for the parent and then a refrigerator and the full bathroom. And the oncology floor is kind of like the fancy, because people are staying there so much longer versus like the surgical floor. Like they have the oncology floor set up for families to be there.
Okay. And when they pulled those cells out, did they genetically alter them or anything? The stem cells? Do you have any idea what they do to those?
No, they didn't do anything to hers. But I know there is, with leukemia treatment, there is where they're taking the blood and reprogramming it. And actually, is it through the Fred Hutch or maybe through Seattle Children's directly? They really have developed for treating leukemia. That's been really successful. And so now they're starting to do it with solid tumors. But that's kind of more like the one doctor was explaining to me, that's more like peeling an onion. Whereas if you have a blood cancer, it's easier to teach your blood to go attack each of the little cancer cells because they're floating, right? They're all like in leukemia or a blood cancer, they're all kind of, it's not solid. Whereas with the solid tumor, they have to teach it then to peel the onion and kill each layer. So it's a different programming. I'm oversimplifying that, but I think they are now, there are some trials being done at Seattle Children's, and there's Dr. Dome is the protocol setting doctor for Vivian's type of cancer he's at Washington, DC, at DC Children's. And he has some trials he's running as well, using some of that.
Wow. Thank goodness for modern medicine. Amazing. Join us again in our next episode where Jennifer continues to share her story of her daughter's journey through childhood cancer. For more information on what you heard today, visit our website at talkinghealthin406.mt.gov. And please be sure and subscribe to our podcast wherever you download your podcasts from. Until next time, take care.